Thank you, Sankalp. I am Dr. Samuel, President of IMA State Goa. A very warm welcome to all respected guest teachers, colleagues, friends, ladies, and gentlemen to this unique webinar on a serious narratives to be considered on men's health, organized under IMA State Goa. I welcome Dr. Ranjit Mankeshwar, Dean of Sir JJ Group of Hospitals and Grand Government Medical College to honor us as our chief guest for today. Thank you, sir. Thank you very much. I welcome Dr. Narayan Reddy, who is the Emeritus of Council of Sex Education and Parenthood International from Chennai, to be our expert guidance and comments. Thank you, sir. I welcome Padma Shri Awardee Professor Shashank Joshi, Senior Psychiatrist Dr. Manoj Bhatavdekar, Senior Sexual Health Physician Professor Deepak Jumani, all from Mumbai, as our star speakers, followed by Dr. Goda Venkatramana from Hyderabad, who has kindly consented to be the moderator for panel discussions. And all the panelists, Dr. Paras Shah from Ahmedabad, Dr. Ritu Santwani from Pune, Dr. Varsha Reddy from Bangalore, and Dr. Rajshekhar Brahma Bhatt from Mumbai. Today is a very sad moment for us. We have lost senior mentor and teacher, Dr. Mahendra Vatsa. I would request Dr. Narayan Reddy to pay a homage to the departed soul.
Friends, Dr. Vatsa can be rightfully called the father of sexology in India. He has trained many of us in this field, and I don't have to tell you, to those of you who are in Bombay or Mumbai, that he comes daily on Mumbai Mirror. He was a great team man, and he is responsible for training thousands of counselors in India through the Family Planning Association of India. His demise is not only a loss to the field of sexology, to me as a personal loss, because I consider him to be as my father, even though we have 26 years age difference. We were never felt that way, more a friend. I used to stay with him in his house whenever I used to come to Mumbai at Shivaji Park. And on all our behalf, on behalf of all the sexologists in India, I would like to offer my condolences to the bereaved family and pay my homage to fully and in the field of sexual health. May he reach Sadgati. Om Shanti.
Thank you, sir. I now invite Dr. Ranjit Mankeshwar, Dean of Sir JJ Group of Hospitals and Grand Government Medical College. He is Professor of Community Medicine Department of JJ Group of Hospitals and renowned statistician, our chief guest for today's important webinar to give his inaugural address.
Good evening, Dr. Samuel. Thank you for that very generous introduction. At the outset, I'd also like to offer my condolences to the departed soul. Dr. Mahendra Vatsa was well known to all those who worked as doctors in Mumbai, and his human contribution cannot be forgotten. I'm very pleased that IMA Goa is conducting this very important seminar on men's health and men's sexuality. This year, especially in the year of the COVID pandemic, it's good that such webinars and seminars take place. You may be proud to know that at Grand Government Medical College and Sir JJ Group of Hospitals, under the able stewardship of Dr. Deepak Jumani, we have a fellowship in clinical sexology. Every year, under his tutorship, there are 4 students. And incidentally, this happens to be a 175th year of Grant Government Medical College and Sir JJ Group of Hospital. So it's a landmark event, a government-run institute. We have a course which is recognized by the Maharashtra University of Health Sciences as well as the Medical Council of India, and we have 4 fellows every year. I think all credit goes to Dr. Jumani for his stewardship and for his background in following up and running the course so well. Before I go and end my short speech, I'd like to give thanks to the association, and I'd also welcome all seminar attendees. And I'm sure your next an hour and a half, you're going to have an academic feast. Thank you, doctors, and thank you, Dr. Jumani, especially.
Thank you, sir.
Thank you, sir, for your encouraging words. Let's begin with our symposium now. Some housekeeping rules. We shall have question and answer after all 3 talks and after the expert comments from Dr. Narayan Reddy in end. It's my great honor and privilege to invite Padma Shri Dr. Shashank Joshi, who is a classified endocrinologist of our country, Dean of Indian College of Physicians. He has been the president of every top associations of our country, API, RSSDI, HSI, IDS, etc., and many more. He is a man with a golden heart and a pride of our country. Professor Shashank Joshi shall address us on waxing and weaning of male libido.
Thank you, Dr. Samuel, for your kind words of introduction. At the onset, I would like to pay my condolences to Professor Mahendra Vatsa, who's no more with us, and may his soul get Sadgati. I'm indeed honored and grateful that stalwarts like Professor Narayan Reddy is here, Dr. Ramanna is here, and I'm here only because of one effusive personality here, Dr. Deepak Jumani. He has a unique ability to attract people around him. And he doesn't even give you the choice. I'm sure, Dr. Samuel, he must have given you my CV. I'm not classified and all that, but also that Dr. Jumani's kindness, I call it Dr. Jumani's kindness. And he has given me not a very easy topic to handle. And I'm going to maybe, I don't know how much time I have, but
30 minutes.
30 minutes I have. So I will quickly run over a few slides. And after that, probably I will, discuss a couple of things. So, sexual difficulties and solutions for a man is what Dr. Jumani wanted me to talk on. And I'm grateful to IMA Goa for having included male health narrative. I like the topic, the way it has been put at. And from an endocrinological perspective, MEN is a very important but ignored health. And men's health programs need to be there across the country. And when it comes to waxing and waning of libido for men's health, I think, we need to be very, very cautious and careful when we evaluate them. So the M stands for mental, the first M, which means I think if you see a waxing and waning libido, one of the commonest causes is psychological. And we have eminent psychiatrists in the panel here, like Dr. Bhatavdekar, and I'm sure he'll throw some more light to it. The E stands for endocrinological, and that is what I am going to allude to from an endocrinological standpoint. And the N stands for neurourological, because there are some causes which are remote and rare, which could still wax and wane on the libido front from a neurovascular or a neurourological issue, but those are usually rarer. So the commonest cause of a waxing and waning libido is probably psychological. Probably 80% of all waxing and waning problems could be psychological or mental. A good 15 to 18% of the issues could be endocrinological. And that could be related to simple hormones. For example, if you are hypothyroid, and if a man is hypothyroid and his TSH is 20 and is not well controlled, he can get a hypoactive sexual disorder. And I give him thyroxine, and after 3 months, I will notice that his thyroid TSH function is normal and his sexual activity is completely normal. Again, winter sets in, his TSH goes up to 8, and again he will have a sexual issue. And that often leads to separation, divorce, and so on and so forth. So it is very, very important to recognize that it could be as simple as a simple TSH, which wanes and waxes due to poor control of thyroid, which can cause a hypoactive sexual disorder, which can impact libido. Or it could be the gonadal, where the testosterone fluctuates. Somebody has adult male hypogonadism, and the testosterone supplementation is not adequate. Testosterone supplementation is intermittent. Testosterone supplementation is not up to the mark. That can also lead to waxing and waning libido. And finally, it will be neurourological, where you can have intermittent corrections which can come and go. I am very going to quickly look at sexual difficulties and solutions for a man, which are some slides which I put on. But fundamentally, if you really want to evaluate a male for waxing and waning, the first narrative to build is it psychiatric, psychological, or in the mind? That's the first narrative we need to ask. Second is, do a gamut of endocrinological tests and ask for history of underlying endocrine dysfunction. Common is being thyroid and testosterone deficiency, which is basically hypothyroidism and hypogonadism. These individuals can wax and wane. These are the two commonest causes in the endocrine world where we get waxing and waning. All other endocrine deficiencies, whether they're adrenal deficiencies, pituitary deficiencies, usually are static and permanent. They don't wax and wane. So, that possibility of waxing and waning may not be there, but you can often get permanent deficits. And neurovascular or neurourological are also rare, but sometimes during therapy, intermittent therapy, you can also get waxing and waning of libido. Now, what I'm going to talk about is, when we look at sexual functions and dysfunctions, we know statistically they occur more frequently in younger women and older men. And usually they occur more frequently in people with less education. And obviously, a lot of sexual perception is subjective, and not everyone experiencing a sexual problem is necessarily distressed or sexually dissatisfied. So obviously, there are a lot of simple situations, and this is an analysis on education and age. And I'm just wanting you to concentrate on the male common here, whether there's a lack of interest in sex, which is what is the topic domain given to me, which is essentially the lack of libido. Of course, there can still be a significant proportion which don't achieve an orgasm. There could be a proportion which has erectile dysfunction, dyspareunia, or early climax, which I'm not going to discuss. And when you look at this 29 countries survey of more than 26,000 people, if you have experienced sexual difficulties in the last 2 months, in the past 12 months, well, you can see on the pecking order, okay, lack of interest or lack of libido is right up to on the pecking order, followed by did not find sex pleasurable, followed by premature climax, followed by physical pain, and males often have the biggest challenge of achieving or maintaining an erection. So that's how the global study of sexual attitudes and behaviors, which was funded by, of course, a company which made sildenafil citrate, was done. This is a very old study, 18-year-old study, and men have it 42%, women have it 47%. And in reality, when you look at this, there's a lot of overlap between desire and arousal, which affects the orgasm, and the effect of desire and arousal, which is sometimes complex. So we get desire phase difficulties and excitement arouse phase difficulties. So these are called as phase difficulties. Difficulties in desire, difficulty in excitement. And then, of course, we have orgasm phase difficulties and dyspareunia, which is not what I'm going to talk. But one thing which I see as an endocrinologist, and then often I have to seek help of people like Dr. Jimani or psychiatrists like Dr. Bhatavadekar, is an entity called hypoactive sexual desire disorder, which is very common in endocrinology. And as I said, it is more often seen in women with hypothyroidism, but often seen with men with hypothyroidism and also with hypogonadism, which waxes and wanes. And this hypoactive sexual disorder or desire disorder is basically a lack of interest both prior to sexual activity as well as lack of desire during sexual experience. So it's a mixture of both. And if the sexual appetite is low, then the person can become aroused or desirous after a sexual experience begins. Then the person does not have an hypoactive sexual desire disorder. And usually this is the hypoactive sexual desire disorder is defined as somebody with low sexual appetite. These terms often are used very loosely or interchangeably. They often have sexual difficulties, but in our endocrine world, we recognize a hypoactive sexual desire disorder quite often. And the commonest cause of that, again, as I said, is mental. It is a lot of life-related stress, relationship issues, rarely medical issues, and sometimes even sexual abuse and trauma. The second challenge which we see from various global surveys which have been done particularly in men, is dissatisfaction with frequency of sexual activity, and that is having a gender bias towards men, which want more sex more frequently than women. And people often have these issues where there is a lot of waxing and waning, and that's related to conflicts, dissatisfaction in relationships, which I'm not going to dwell with, as I said, because those are all mental issues. And very rarely we encounter a very extreme irrational fear of sexual activity, which can also wax and wane. And that's a sexual aversion disorder. Again, it's in the domain of psychiatry, and this is called as the sexual panic or sexual anxiety, which is something which occasionally we will do that. The female sexual arousal disorder, I'm not going to discuss. The persistent sexual arousal disorder can be occasionally seen, but what we often see is the male erectile disorder, which sexologists see, and I'm sure Dr. Reddy and the group sees here quite often, which is a consistent or a recurrent inability to have or maintain an erection sufficient for sexual activity for more than 3 months. And it's quite common. It's 1 in 5 in men above 20. And that's the graph which is put out here. That's a very simplistic graph. I'm sure I'm not going to discuss the female orgasmic disorder, but a small proportion of men also have a ejaculatory dysfunction, and 8% of the people can have a male orgasmic disorder. And of course, the most common male sexual difficulty is premature ejaculation. And we know the pattern of ejaculation. I'm sure Dr. Jumani will discuss that. And it can be 20 to 30% worldwide with ages between 18 to 59. And that's something which we know, and it has a mixed component. And there is still a component of faking orgasms, even in men. So usually we always talk that when we fake orgasms, it's women, but rarely it can also be men. And the reasons they fake orgasms is to avoid disappointment and hurting their partners. And it's a vicious cycle. And remember that even men can fake orgasms, whether they are heterosexual or they are bisexual or homosexual. So that's clearly there. So obviously, faking orgasm can occur in men. Premature ejaculation, I'm not going to discuss, but can occur in men. Obviously, the other challenges which we have are dyspareunia. It can occur in men too. So it's very unusual to occur in men, but people who have phimosis, tight foreskin, poor hygiene, and uncircumcised penis, they can have challenges with painful situations. And then there are various other syndromes which I don't want to discuss, vascular, hormonal, neurological issues which are there. But also drug abuse never has to be forgotten, and a very poor diet. Okay, we all know that if you get metabolic syndrome or diabetes, fundamentally the sex hormone binding globulin is downregulated, and there is the bioavailable testosterone in men goes down significantly. So we know that 90% of men, their endocrine axis, because obesity and fat has an enzyme called aromatase, and that downregulates a lot of testosterone. And then automatically you get an erectile dysfunction. You lose weight, your erectile function improves. You gain weight, your erectile function comes up. Again, that's a situation of waxing and waning libido, and that's very, very common. Beyond that, of course, we know alcohol. When there are seasons of alcohol, we know that sometimes in winters you drink more than summers. So you can again have a waxing and waning due to alcohol. Marijuana, is very common to reduce testosterone levels in men and sexual desire in both cases. Tobacco affects it quite commonly. Cocaine can cause a challenge with erections. Amphetamine can cause, again, intermittent, and so can barbiturate. So these are all situations. But the commonest thing which I see in clinical practice from an endocrinology standpoint is obesity, waxing and waning or yo-yo phenomenon of weight in men, and diabetes. And that often blunts, from an endocrine standpoint, a lot of sexual libido. Any chronic illness can impact sexual functioning because of direct impairment, as I said, of the mind, hormones, nerves, or vessels. So it is usually, as I said, it is MEN again, mental, endocrinological, neurovascular, or neurourological, or and that could be very common. But the most common cause in chronic illnesses is chronic persistent fatigue can impact it. Diabetes is a huge challenge which we see every day, day in and day out. That's what I see. In fact, for me, the commonest cause of waxing and waning libido is diabetes. Better glucose control, and there is better sexual function. Poorer glucose control will lead often to penile candidiasis, and you will often have poorer sexual desire also, because you know that in diabetes you get a form of functional hypogonadism. We also get objective hypogonadism, which is adults. So we can get a dysfunction of both. And of course, people who undergo cancer chemotherapy and radiation, they also have their endocrine axis blunted. Often neurovascular functions are impacted, and also a lot of nausea, fatigue, pain, negative body image after surgery, and cancers of reproductive system can have impact on sexual functioning. Very rarely, as I told you, neurological causes are important. I am not getting into it, but we don't have a neurologist here. But multiple sclerosis is very, very common to see a fluctuating, because multiple sclerosis can be in remission and in active disease. And you will often get fluctuating sexual functioning, right from lack of sexual interest or genital sensation to a reduced arousal or even hypersensitivity to genital stimulation. So but MS should never be forgotten, or autoimmune neurological disorders as a big thing. And others common causes are strokes or cerebrovascular accidents, where again we know very commonly that you can get a state called multi-infarct state. Commonest is in hypertension. So after diabetes, the second most common condition where we see a lot of sexual waxing and waning is poor hypertensive control, leading to a multi-infarct state in the brain, leading to CVAs, which are often not noticed. And you get a shower of microembolia when you do an MR, and often they have a waxing and waning libido. So obviously, also remember, a lot of prescription and over-the-counter medications can have negative effects on sexuality. And obviously, we know that most commonly, I'm sure Dr. Bhatavdekar will tell you, antidepressant reduce the sexual interest. When you stop them, then there is again improvement. Antipsychotics often frequently have a loss of an organ, and a lot of these standard which you get. We also know antihypertensive medications directly impact desire, arousal, and various other things. And then a lot of other simple things like antihistaminic medications or gastrointestinal medications, they can all impact the arousal and orgasm. Obviously, there are other diseases which can rarely be there, but usually cause a permanent damage. So I would not discuss here, like cerebral palsy or any spinal cord injury, which can do that. We all know that spinal cord has a direct impact on the erection, and that is an extremely well-known thing. Here is just an illustrative diagram to show you that psychogenic stimulation is the most important, whether it's visual, auditory, tactile, olfactory, gustatory, memory, and imagination. But the spinal cord has a dual function. One is, of course, the reflexogenic stimulation, that is tactile stimulation of genitals or bowel and bladder stimuli, leading to the sacral erection center of S2 to S4, or the thoracolumbar erection center at T11 to L2, and obviously the vasodilation leading to increased flow and erection. So clearly, the other challenges which can also be seen are people who are deaf or blind. They have challenges with their sexual dysfunction that can very rarely wax and wane. And any chronic disease can have waxing and waning. Of course, I'm not getting into the psychological issues at all, particularly the childhood-related issues, the sexuality issues, performance anxiety, the sexual knowledge and attitudes, abuse, emotional issues. I'm not going to do that. But a lot in men's health and libido in men's health is got to do with self-image. And I'm sure that there are better experts who see this every day. The very fact that they seek help from an endocrinologist rarely, usually they go to a sexologist, and very rarely they go to a urologist, is because they have self-image issues. And then and now, and they read all this. And our biggest barrier is, as doctors, we are challenged by Dr. WhatsApp University and Dr. Google University, and they're competing in a non-evidence way. A lot of unregulated information which is available on the net, and that leads to a very poor self-esteem and a poor self-image issue, and therefore image management is a very crucial entity. Also, self-esteem, self-confidence has better sexual satisfaction, and we clearly know that body image affects sexuality. It is important for women, but men are getting more and more visible now. We know these male models and stars have no visible body hair, they get beefier, and pawns are giving some unrealistic size. The commonest thing which comes to me as an endocrinologist is people think perceivably that they're small penile size, and that is predominantly because of all the unadulterated adult literature which is available. And we have to often counsel that the stretched penile length, we measure the SPL, or stretched penile length, and testicular volume, has nothing to do with sexual activity, but it takes a lot of counseling. It needs that we often have to do an endocrinological test, show them that they have a normal testosterone, FSH, LH, they are fully capable, show them that they have a normal semen count, and often counseling. All you need to do is just counsel them and reassure them. Of course, there are a lot of psychological issues, and I'm not getting into the psychological issues at all. I'm neither getting into sexually transmitted diseases, and there are a lot of issues related to sex therapy. But important thing, key, is self-awareness and communication. And we need to get them to a therapist so that they can counsel them. And that's where I sometimes take help from people like Dr. Jumani, who are very good therapists, who spend adequate time, tell the couples for intimacy, and then they overcome various issues related to that. So obviously the strategies are often, and the other challenge which we get is for delayed ejaculation, and the various communication and educational strategies we need to do. There are several of these techniques which are available. I don't want to get into details of those at all, because there are better experts who will tell that. And the other challenge is, of course, psychological. I'm sure Dr. Bhatavdekar will do justice to it, that we need to reduce performance anxiety. And I think we need to sensate on exercises. So what I do as an endocrinologist is I often encourage them to have adequate sleep. I tell them to do adequate exercise, do yoga, do some muscle building exercises, and have some foreplay. Give them some simple explanations. Tell them their hormones are good. And sometimes we use drugs like any of these drugs which we use. We use nowadays tadalafil because sildenafil has their own challenges. Rarely we use that, and sometimes we use also some vasoactive medications. Rarely we use any of these surgical treatments, and we do use testosterone. I use a lot of testosterone because I see a lot of hypogonadism. So obviously we need to identify and clarify problems and goals. We need to go into history, and we need to give them to a therapist, and we need to select a therapist appropriately. We need to go to a trusted source who maintains confidentiality, looks at all the training and credentials they have. And that is why we have people like Dr. Reddy, Dr. Jumani, and all others on the group who have led this whole movement of sexual medicine in India. And they are really revolutionary. And we have this whole expert panel. I don't know each one of you all individually, but I think from an endocrine standpoint, waxing and waning of libido has a simple MEN, which is mental, endocrinological, and neurovascular or neurourological. In the endocrinological space, we look at two T's. One is thyroid, TSH. Second is testosterone. Beyond that, rare endocrine disorders, we are there as endocrinologists. But maintaining the TSH normal will prevent hypoactive sexual disorder and waxing and waning. And second is testosterone. If it is given intermittently and the T is not well maintained, then again you will get a waxing and waning. The treatment is very, very simple, that we need to do M, again MEN I will tell you. M is to ensure that they get their medications appropriately. Appropriate medications are important. E stands for education and emotional support. Okay, so that is the second E. And the N really stands to ensure that we build a very positive narrative. So I call it negating the negative or building a positive narrative. And I think if we are able to do that in an appropriate way, I think men are more shy than women, and they often need to be told what is correct and what is not correct. Unfortunately, because of internet, they read too much. They land up with endocrinologists. And when we reassure them that their hormones are okay, it's fine. But as endocrinologists, we often encounter that. And the last thing which I want to tell is we are having a pandemic of diabetes. Every year, 4 million people die due to diabetes. India has almost 80 million diabetics, another 80 million who are pre-diabetics. And as the glucose goes up in dysglycemia, the libido goes down. As the glucose improves, the libido improves. And as you put on more weight, the more fat you will put on, more will be the aromatase in your fat cells. The testosterone will go down. So obesity is a state of functional hypogonadism. More weight you will lose, the better it is. So I tell all my patients one simple advice, which is a simple lifestyle advice, that eat less, eat on time, eat slowly, don't eat fast, because when you eat fast, you secrete more insulin. Eat the right food. Try to have a large breakfast, moderate lunch, and a light dinner, because it impacts sexual health particularly. And therefore, we always tell them to have a large proportion in the morning, a moderate proportion for lunch, and a light portion at night for dinner. The other thing we tell them is do at least 10,000 steps per day, or do some form of yoga, some form of suryasana, some muscle building exercises. They definitely improve their self-image and self-esteem. We tell them to have a good 7 hours of sleep, because that is very crucial for good sexual health and endocrine health. And we tell them to be smiling and positive, because the unnecessary negativity which they get, that creates a problem. This not only helps them to manage their diabetes better, their endocrine disorders better, but I think overall for sexual functioning, this is very crucial and critical. I'll be more than happy to answer any questions. I think Probably I've just been a little short of my time because I love to do a lot of interactions. Or maybe we can do that at the end after all the three speakers have spoken. But I'm very grateful that all of you all felt sexual health as an important entity to discuss. So I should congratulate IMA Goa for having this topic and Dr. Samuel and his whole team. And I must particularly thank all these wonderful panelists. I'm looking forward to hear to all of you all because, as I said, we all are here to listen. What we listen, we learn. What we learn, we should adapt. So I hope that I have given you some take-home points which may be useful for. We are all here to improve the men's health of our country because that is crucial and important, because it is important that if the sexual health is good, then there is happiness around, and if there is good happiness, then there is good health. So I think it's all indirectly correlated. So I think it's very important to look after men's health. And again, as I said, I'm thankful to all the organizers for keeping men's health at the focus of your narrative. Thank you so much.
For the wonderful overview on the men's health, which does affect relationships and also quality of life. In fact, hormones do sabotage our sex lives. Thanks for that enlightening us, sir. We shall have expert comments by Dr. Narayan Reddy at the end of the three talks. I now invite my friend Dr. Professor Deepak Jumani, attached to Sir JJ Group of Hospitals and Grand Government Medical College as a sexual health physician. He is also attached to Police Hospital. Dr. Jumani shall give us a narrative of what happens to the men after 40.
Thank you, Samuel. At the outset, I pay my homage to my mentor, teacher, late Dr. Mahendra Vatsa. He was a wonderful human being. I have had very good interactions with him. I also thank Dr. Samuel and the whole team of IMA Goa for inviting me and honoring me to give me an opportunity to share my thoughts, views, concepts, and passion. The topic given to me is naughty at 40. I mean, I don't understand. Every age is wonderful. Every age has its own beauty. But it would be impossible to go against the force of nature for people above 40 to act as though they were performing when they were 20 or 30. Our body has a certain way of operating at every age. Men men at the age of 40 become like open soda bottles. Before the fizz runs out, they try to take the last leap. Why men get naughty? This is a very, very important question, but that does not have a validated answer. But I'll try to clear off in this next 30 minutes some cobwebs about it. The most important thing is the age. Age is a natural born killer. As you age, men sober down at the age of 30, but as they turn 40, some exhibit mischievous teen-like symptoms. They feel that the prime of their youth is fading, and they try to plunge into naughtiness, and they believe that this will maintain their youth, which is something rubbish.
Gurur Brahma Gurur Vishnu Gurur Devo Maheshwara Gurur Sakshat Parabrahma Tasmai Shri Guruve Namaha Tasmai Shri Guruve Namaha Tasmai Shri Guruve Namaha.
I thank my beloved teachers, Dr. O.P. Kapoor, Dr. Prakash Kothari, and Padma Shri awardee, Dr. Shashank Joshi, and I beseech them to bless me always. Whatever I am today is all because of my teachers. I have some disclosures. I am not responsible for Section 377 verdict. I am also not responsible for Section 497 verdict, which allows adultery as a normal thing. Rekha asks Amitabh, now 497 has been dissolved. but he says it's too late now. But then again, he thinks it over and tells, let me talk to Dr. Jumani. At the beginning of marriage, every wife treats her husband as God, Pati Parameshwar. But somehow, later in the marriage, I don't know why, the words interchange. What urges men make men chase women they have no intentions of marrying? It is the same urge that dogs have chase vehicles where they have no intentions of driving. James Prescott, the famous developmental neuropsychologist, says our brains have built-in reciprocal relationship between violence and pleasure. So if you want to decrease violence in your life, you must increase your pleasures. Gina Ogden and Betty Dodson claim that any stored feelings or unmet sexual desires can morph into physical symptoms and can contribute to sexual problems. Every wife is a mistress for her husband. Miss for 1 hour and the stress for the rest 23 hours. Men are permanently on the naughty list. Sexual interests start early in the boys. When they are adolescent, they have worries about the size of penis, masturbation, so many other things. At the age of 15 to 20, their hormones are bubbling. They are called tempting 20. It's called Pehla Nasha. Between 20 and 30, they are too good. It's terrific 30. Dhoom machane, they call it. Between 30 and 39, sometimes they have breakups. So it's called throbbing 30s. Kabhi khushi, kabhi gum. At the 40, he's scared. Kal sala ho da ho. He might not get erection, so he becomes naughty. At 50, he knows he's got Pappu can't dance sala. It's a fear of 50 he always has. But at 60, again, he finds his hormone to be dwindling. He says, Buddha hoga tera baap. So nothing gets old in a man's mind. Why he becomes naughty? No matter how much a man loves his wife, his attraction for the opposite sex never ends. Some married men will act on these impulses of attractions while others will try to hide it. Men over 40 will always try to do they did not get chance to do during their younger years. And it is also said the grass is always greener on the other side. Every male has some or the other bedroom woes. Every male today. Even putting on condom, the calories expenditure is around 6 with an erection. But if he does not have an erection, it takes a lot of time. It takes about 350 calories. In a missionary position, when he's having sex, it's simple. It's about 12 calories. But if he has to change the position, it's about 250 calories. And once he has finished with his ejaculation, when he's just lying down bed hugging, it's only 18 calories post ejaculation. But if he has to get up immediately, he has to struggle. It's 36 calories. But if he has to explain why is he getting up soon, he spends 816 calories. But if he has to dress up simply, it's only 36 calories. But if he's in a hurry, he has to ask 98 calories. If his dad is knocking at the door, he spends about 1250 calories. But if his spouse is knocking the door, he spends about 3600 calories. What men think they want in their sex life and what women think they need. Let's unravel the blindfold. Working wives, husbands always felt ignored. Working husbands, wives felt ignored. In the era of high tech today, there is no communication in the bedroom. You look at this man, he's working on his laptop with his cell. No communication at all. There is quarrel and there is no sex at all. Who ruins our sex life on daily basis? It's the TV serials and Arnab's debates. Both are responsible for our loss of sex life. And male life itself, after the age of 59 to 65, he has to thrash, but still nothing happens. Other comorbidities like cardiovascular disease, metabolic syndrome, endocrine disorders, arthritis, obstetric sleep apnea, cancer, drugs, aging, etc. When something goes wrong in his sex life, he loses his self-esteem. But let us understand, is sexual activity beneficial? Does it have a risk after the age of 40? No. Sexual activity has been proven to be the predictor of general health and longevity. Two beautiful studies by Davis Smith says that 50% risk mortality is less in men with higher frequencies of orgasms. And men reporting intercourse less than once per week develop twice the incidence of erectile dysfunction in those reporting less than once a week. Three beautiful studies which I will mention. The Duke's longitudinal study said the frequency of intercourse is a significant predictor of longevity in men, and early cessation of sex was associated with premature death, and 50% reduction in cardiac death with more than 2 orgasms per week. So it's very important for us to understand that having sexual activity is very good. And nobody has died of myocardial infarction while having sex. So sexual activity triggering myocardial infarction is one less thing to be worried about. Beautiful publications in JAMA. But still, patients die after having sex. Who are these patients? The majority of coital deaths occur with an unfamiliar partner in an unfamiliar setting after excessive alcohol and food intake. So that's the key to it. What's good for healthy sex? What do we need to have good healthy sex? Do we need exercise? Yes. There are 5 top exercises: push-ups, abdominals, deep lifts, torso swings, swimming. 30 minutes of these 5 times a week are very good for sexual. Does diet make a difference? Yes. Let me give you a little historical perspective on how diet is important. The most beautiful woman in the history of mankind, she was a symbol of passion, love, and beauty. She was epitome of pure femininity. Her flawless skin, effortless allure made her the height of confidence and attraction. She was known to make any man fall in love with her at first sight. She was the goddess of love who excited this passion in the hearts of every human. And who was she? She was the Greek goddess of love, beauty, and sexuality, the Aphrodite, on whose name aphrodisiacs have come. Now, what did Aphrodite do to make everyone have lust for her? Did she go to a parlor? Did she eat something? Did she get her bariatric surgery done? Was she on some medications? No. The secret lay in the diet of metabolic superfoods which she had. And this unusual ancient diet which these people had is also available to us. Aphrodisiacs are nothing but substances that excite, induce, or boost sexual desires. All these things, red colored fruits, vegetables, green vegetables, cows, but all I advise my patient is to avoid SOS, because these 3 things hamper the sex life. And you know what is SOS? Avoiding salt, oil, and sugar. This is very important for us. Romans used carrots, and Romans also used tomatoes in their parliament, and those were very effective, and they increased their sexual desire. And dark chocolates contain phenylalanine, which boosts arousal and enhances mood. When I googled about what can increase the male sexuality, when I typed male sexual enhancement devices, I found 86 million results in just 50 seconds. For penile enlargement, I want 43 million pages in just 46 seconds. And how to last longer in bed, there were more than 112 million web pages in just 44 seconds. And supplements, my God, 27 millions. But all these advertisements are deceptive, misleading, and wrongly claim unexpected and unrealistic results. So we should caution our patients about all that. There are 7 reasons why libido decreases. My teacher, Dr. Shashank Joshi, alluded beautifully. But I would give you some practical hints. Plastic bottles, which contain bisphenol A, they are harmful. Overweight, adipose tissue contains aromatase, which converts testosterone into estrogen. Diabetes reduces testosterone. Decrease sleep. Sleep is very important. It increase if you reduce sleep. If you are sleep deprived, your cortisol levels will increase, and there will be lowering of morning testosterone levels. Certain soya foods, low-fat diet, zinc deficiency, vitamin E and C deficiency can also cause less libido. Stress increase cortisol levels, increases GnRH. It reduces the testosterone. Alcohol, beer is supposed to be estrogenic, and suppose if somebody is not having sex at all, also decreases his ability. There are 6 cities across the world where people are living 100 years. Dan Buettner from National Geographic found out why these people are living more than 100 years and they are sexually active. So we are also going to live long, more than 60 years. Our longevity is increased. How do we want to live this 60 plus years? Do we want to live in autonomy, dignity, grace, or be sexually happy? Or we want to be diseased, depressed, dependent, or unhappy, or emotionally crippled? So we need to understand, though we have a good lifespan, we should increase our health span also. Now, let me give you a deeper perspective. Why old men are attracted to younger women? Why? Because they feel younger women are more adventurous. They crave eternal youth and so choose to be with younger women. Men always feel that they should remain youth till the end of their life. Younger women are more open to newer things sexually with their own partners or not. Older women have an emotional maturity that some men can't handle. Some men can't handle the emotional maturity of their partners. Some men might find women their age hard to control, so they seek outside. Who cheats whom when some infidelity or extramarital things happen? Cheating is a choice, not a mistake. This is nothing but mental mind mess. The shame, the fear when you're caught, the guilt, it's very difficult to cope with it. So I call it mental mind mess which men create themselves. The rich and famous all had affairs. Men cheat for sexual reasons, women cheat for emotional reasons. So this emotional roller coaster has to be stopped. It needs to be stopped. We should let go of expectations. We must go in the bedroom without any expectations, and we should learn to give and accept. We should focus on sexual pleasure. It's not about getting an orgasm or getting an ejaculation or early ejaculation or whatever it may be. It's the whole experience. What is love begins at 40, life begins at 40. We need to look at the inner beauty of our partners. We need to change ourselves, not the spouse. When you make yourself vulnerable to your partner and not nag, you grow in your marriage. You don't distance, stonewall, or play blame games. Try new things in bed, whatever you can, something new. Express spontaneity. Vatsayana says use 64 different positions rather than using 64 different. So what do we need? We need a well-rested body, adequate time, privacy, conducive environment, a relaxed state of mind, and an attraction for the partner will have the same effect. If the couple doesn't feel for each other, nothing helps. So we control hyperglycemia, hypertension, and dyslipidemia. Follow lifestyle. Make it as your religion. You may be Hindu, Muslim, Sikh, whatever it is, but make lifestyle as your religion. Plant-based food, 150 minutes per week for walk, adequate sleep, medications, avoid smoking, certain methods to reduce stress, etc. Avoid smoking, do workouts, sleep. We doctors are sleep deprived. We did a study with orchidometer at JJ Hospital of doctors, and we found the sizes of the testes were reduced. When the sizes of testes, the volume decreases, definitely everything goes haywire. Touch, couples hardly touch each other because touch improves the pleasurable satiety. Don't even hug each other. Hugging, embraces, or touches hard. We need to increase our romance. Yogic exercises are beautiful. We need to learn all the relaxation techniques which can help us. But there is certain role of women to play to avoid men becoming naughty. What they can do is, what women can do is, men are visual. They should turn off the sensual switch. Think of novel ideas, places for sex. Women who love sex, never make excuses. Never criticize your husband in bed. Never compare your husband to any other. Regard him as a hero. Yeda hai, teda hai, lekin mera hai. So you must understand that he should stop. Other things which they can do is stop conventional intercourse, try different positions, kiss and cuddle more, practice creative foreplay, don't touch his genitalias, encourage him to masturbate or do it for him, create fantasy situation. He should not have the pressures to perform any time. Don't give him any pressures to perform. What men should do, there is certain things which men also should do. Make her feel on the top of the world. Agree with her. First, do what she says. Keep your mouth shut and smile. Encourage her to discover her hidden talents. Give her time, not gifts. But what I find, there is total, absolute, persistent disregard towards women's satisfaction by Indian men. They they ejaculate, they turn themselves on the other side and sleep. They use their partners as a sleeping pill, which is wrong. After he ejaculates, he should hold her tight, hug her, tell her she was beautiful, she was awesome, give her all the compliments and do everything what he did during foreplay again. Because this is a must. Because if you look at a girl who's good looking, did a lot of makeover, anybody would say she is gorgeous. But if you're complimenting your partner in the bedroom, you give her a signal that you like her the way she is, and that speaks miles. Mutual satisfaction is the benchmark. Samabhog means equal joy, which is important. Husbands watch porn, wife are working in the kitchen. Wife knows that what my husband is doing. You are giving her a signal that you like her, the girl in the movie, more than her. This is wrong. Watch together. Nothing wrong. Watch the porn together. A husband should criticize the girl in the movie more. So that will bring her closer to. Bedroom today is used for everything else except sex. We are using it for watching television, dancing, eating, anything, but there is no sex. Bedroom ethics are, bedroom is only for sleep and sex. There is a gender bias. Hypogonadal men, younger boy, go to the gym, take testosterone without the fear of getting prostate issues, etc. But women are not given hormone replacement cell. A woman feels sexually invisible. A woman without hormones is like a Ferrari without a fuel. Nothing wrong. Give her a pulse therapy of hormones and bring thrill in her body and mind and sex. A woman always feels love me till my heart stops. A hero is zero without her. So we must understand feminism needs to be admired, adored, trusted, and respected. If a man who doesn't admire, adore, trust, and respect feminism, I pray to God that he should get permanent erectile dysfunctions. Wrinkles don't hurt. Sex at a certain age after 40 is not for reproduction or recreation. It's for maintaining relationships. And the language of love which your partner understands is communication and romance. Men will only think about sex. My take home message is have realistic expectations. When you are 20, what a woman should know that men will slow down after some years. Men are more ready to listen to what will pleasure us. Men need to know that they can become aroused in 2 to 3 minutes. Women take 10 times longer. Even every affection need not turn into a sexual overtone. So the solution is talk to your spouse about sex. Communication improves. Don't say no. Negotiate. Compromise times and types. At 30, when you are fighting with your careers and six, women need to know that men's erections become sluggish. Men grudgingly accepts no for sex. Her weight, height doesn't affect husband's sexual fires. Men need to know begging, pouting for sex does not entice his wife. Women need great deal of affirmations about their bodies. So the solution is we need to spice up things, get creative to time, place, position, types, wife needs, etc. And sometimes even erotic touching or massages help. At 40, women need to know that communicating your intimacy needs are important. Men need affirmation for his sexual prowess because men has fear, kal ho na ho. Men need to know, recognize his wife's natural prime. Women need attention spelled as time. So practice slow love making. Seek treatment for early ejaculation or erectile dysfunction or andropause. When you are 50 and above, men need more foreplay. Create anticipation, sexier whispers, seductive touch, satin lingerie is all women should know. And men should know to go slow and have a longer foreplay. She may need vaginal estrogen to moisturize her vagina because of dryness, testosterone gel to reverse the loss of desire. Men may need Viagra. So the secret of sexual happiness is understanding that our sexuality is ever evolving. It changes. What feels good at one time may not feel good at other time. Our desires may be high at one time, may not be at another time, within relationship or within ourselves. We must reclaim pleasure. We must prioritize our pleasure. We must adopt and adapt to lifestyle measures. This is an attitude shift which we all, even males and females, should have. So the secret of sexual fitness is love yourself. You are a sexual human being. Avoid salt, oil, and sugars. Have a regular rhythm of sex life. Be connected with your partner all times and touch, because the beauty at a certain age moves from the face to the heart. That's very important. Unless we love and are loved, we all are alone and deeply lonely. Love each other unconditionally. There should be no conditions in between. So let's decide. Yesterday I was clever. I wanted to change the world. I was naughty. But today I'm wise. So I have changed myself. Men are born between women's legs and they spend rest of their lives trying to get back in between them. Why they want to do that? It's because there is no place like home. So friends, my last few slides. Monogamous relationship is like a garden and polygamous relationship is like a jungle. Now you have to choose whether you want to be a gardener or a jungly. But if you want to make your garden beautiful, you need to devote time. You need to cut the right type of trees, put fertilizers, water, etc. So Voltaire beautifully said, try and cultivate your own garden. But men will be men, that's for sure. A man needs to feel needed. A man needs to feel appreciated. A man needs acceptance, because मर्द को भी दर्द होता है यार. If you have patients of any sexual dysfunctions, please treat them yourself, or try to don't send them to quacks. Send them to good sexologists. You will see that he gives him a good sex life. This is my book, Sex Has No Expiry Date, available on Amazon. My last slide. Men and women may become naughty after 40, but must learn to be sex smart at all ages. Sexual fitness is a choice and lifestyle decision. Erectile dysfunction is most prevalent male sexual dysfunctions. Low dose PD5 inhibitors, statins are effective. L-arginine supplement and fenugreek is a boon. Diet and exercise are the key. Lifestyle measures can reverse metabolic syndrome. The best sex stimulant is your own fantasy and your own excited partner. A heart that loves is always young. Age, weight, height are just numbers. Erectile dysfunction, friends, today is a correctile dysfunction. And if this happens, sex really has no expiry date. Thank you all for your love. I shall also ready to answer any questions at the end of the three talks.
Thank you, Dr. Jumani, for that accelerating and interesting aspect of men's psyche and how best to deal with proper mindset and attitude. I now invite Dr. Manoj Bhatavadekar, who is a senior psychiatrist and a counselor from Mumbai. A very soft spoken, brilliant, and humble human being and a classified mental health expert. Dr. Manoj shall now tell us about how psych gets affected with issues in the bedroom, men's bedroom blues.
Good evening, everyone. Am I audible?
Yes.
Yes, sir.
Yes, thank you so much. Um, at the outset, please allow me to express my deepest condolences on the death of Dr. Mahendra Vatsa, whose column today's teenagers enjoyed reading in Mumbai Mirror, and they used to have many of their queries solved reading his column. Also, please allow me to thank Dr. Deepak Jumani for roping me in, and my sincere thanks to Goa IMA for inviting me, and congratulations to them for holding a webinar on a topic which is as important as men's health, which is very often ignored. And my topic today is men's bedroom blues. Is the screen visible?
Yes.
Okay, thank you. Yes. So, as Dr. Shashank Joshi mentioned, the word MEN begins with M, mental. And very often, a psychiatrist is the missing link. And he remains missing for a long time in the whole process of treatment of a person who has sexual disorders. And this is the famous Michelangelo painting. And you will see that the gap between two fingers is so small, but still that gap is very important. And the missing link between something which is spiritual on one hand and bodily on the other is the mind. And hence, we need to understand the importance of the mind in the whole process. I'm going to give in this presentation my perspective as a psychiatrist. I've been practicing psychiatry for more than 30 years, and I've had the opportunity to deal with child and adolescent psychiatry a lot. I've had the experience, the opportunity of conducting so many workshops on sex education. And therefore, as a psychiatrist, I find that human sex is peculiar in many ways. First of all, you will agree with me that human sexuality is between the two ears and not between the two legs. The entire psychoneuroendocrine immune axis that we function with has something to do with human sexuality. Human sexuality is also mainly for pleasure and also for reproduction, by the way. So, the main purpose of human sexuality is for pleasure. Thirdly, you'll agree with me, especially so in our country, that sex is not much openly discussed, not much talked about, but much sought after privately. And because human beings get married, sex is an important part of married life and also unmarried life. Sex is affected by several factors apart from physical factors. And what are these dimensions? So there are physical dimensions, psychological dimensions, social dimensions, cultural dimensions, religious dimensions, several aspects. I mean, I still remember about 20-25 years ago when I was conducting a workshop for adolescents on sexuality, sex education. A boy studying in the 8th standard raised his hand and said, "Doctor, can you discuss the concept of beauty?" A question coming from a 12-year-old, right? So these are questions which we need to be able to answer. What is peculiar about men's sexuality, since we're talking about men's sexual health today? As far as men are concerned, the male sexual responses, they're different from a woman's. Therefore, for a man, it's a matter of performance, achievement, and a woman is supposed to be receptive, a man is supposed to be aggressive, he penetrates. So it's a matter of performance, it's a matter of achievement, it's a matter of self esteem for him, right from the size of the organ, the duration of sex, and then there are talks in the locker room which between men which discuss some of these issues, and then there are people who feel jealous of each other. There is a lot of guilt and shame that is associated with poor performance. Then there are perceptions and belief systems which are altered by pornography and ads. As Dr. Shashank Joshi and Deepak, both of them mentioned about, there are about ads which talk a lot about enlargement of the penis. So having a larger sized organ is supposed to be a sign of masculinity. Having a cigarette in hands is a sign of masculinity. And we all know the effects of tobacco on sexual dysfunction, on sexual functions, right? Influence of social media, cyber sex, sexting. Right now, I'm handling the case of a teenager who was brought to me by his parents. He's 13, just 13, he just achieved puberty maybe a year ago. And he was found to be sending porn images to a classmate girl, and this was discovered, and there has been a chaos. So such things are happening at that age nowadays. So times are changing. This is something that I would like to say right in the beginning, that the whole concept of sex, because of the social cultural dimensions that it has and the psychological dimensions that it has evolved over a period of time. First, I mean, years ago maybe, sex was defined as what a man does to a woman. It's as simple as that. Second, the second definition, the second level of definition after it evolved was what a man and woman do with each other. The third and probably the most evolved and the most mature definition of sex is what a man and a woman do for each other. So if you look at the way these definitions have evolved, you will agree with me that perceptions have changed, expectations have changed, presentations have changed, and interventions have changed. So, how do men's bedroom blues get presented to a psychiatrist? First of all, there is a lot of stigma that is associated with mental illness. There are stereotypes. So, mental illness is equated with madness very often. Mental illnesses is not supposed to get better. They are labeled as insane people. You go to a psychiatrist, people won't mind going to a red light area, but going to a psychiatrist, maybe they'll think 10 times. I still remember in the early years of my practice, a person who came to my clinic and said, I want to bring my son to you, but will you please cover the board of your clinic which says consulting psychiatrist? Because my son is young and I want to get him married. If other people notice me in your waiting room and they come to know that I brought him to you, who will give him a girl? So that was the stigma. Of course, the stigma is reducing. However, stigma still exists pertaining to mental illnesses, pertaining to sexual dysfunctions. And when mental illness and sexual dysfunction they exist together, you can imagine the degree of stigma. Also, there is lack of awareness even among medical professionals about both mental illnesses and sexuality. This is a very common stereotype. Men are stereotyped as sex obsessed machines. So, as if there is a man and men will be men, and all those kinds of things are talked about. That is why probably men, when they have sexual dysfunction, they find it very difficult to seek help many times. There are common causes of men's bedroom blues. Let's talk about the normal, so-called normal range. Why I'm calling them normal is because they do not require drug treatment. They do not require a prolonged treatment. Most of these are treatable with counseling or with a change in lifestyle. So age-related issues, some of them Dr. Shashank talked about, some of them Deepak talked about, and age-related changes in libido. So maybe somebody is hypersexual during young age, and with declining age, the libido goes down, which is a natural course, andropause. Then a very, very common factor that we find nowadays is busy schedules and poor work-life balance. I know several friends working in the IT sector, finance sector, who are terribly busy, corporate lifestyle. The husband and wife both are working. The only communication that takes place between them is some notes which are stuck on the fridge with the help of a magnet, that there is food kept here, these clothes are ironed, something of the kind. And there is hardly any time that they spend together. And on Sundays, the husband goes to sleep because he's sleep deprived, or the woman is excessively tired. So at the most, they can go out for a lunch or the dinner and they come home and go to sleep. So poor communication between the husband and the wife has become a very, very common factor, an important factor in urban life. Then there are communication issues between partners. Different expectations, different backgrounds. The time to gel with each other is probably missing. Then other disorders like hypertension, diabetes, which typically begin after the age of 40, and it's very commonly said that if it's a group of men who are friends, they get together and the topic of discussion is no longer girls, it is lipid profile and HbA1c and blood sugars, probably they have crossed 40, right? So remember one thing, most of these things that I'm talking about are amenable to interventions which are not very serious or severe, but interventions are required. Most of them, as I said, are treatable with counseling and with changes in lifestyle. There are several disorders that present with sexual dysfunction, several mental disorders. In today's talk, I'm going to specifically talk about depressive disorders only, and I've discussed this with Deepak also. Why? Because depression is the second disease after ischemic heart disease, according to WHO, which carries a lot of global burden. The global burden of disease is very, very high in depression. And we need to understand that depression is a disorder which can be easily recognized, number one. It can easily be treated, number two. And three, it is one of the commonest disorders which presents with sexual dysfunction. So we need to understand what depression actually means. You know, it's a misnomer. Very often, I find that any person who has some emotional disturbance or some behavioral disturbance is labeled as depression. Even people with schizophrenia are labeled having depression. People with anxieties are labeled having depression. First of all, we need to understand that sadness is a normal human emotion. It's a primary emotion. So fear, anger, joy, sorrow are common primary emotions, sadness being one of them. How does depression differ from normal sadness? Any sadness that is severe in intensity, any sadness that is persistent over a long period of time, at least 2 weeks, any sadness which is pervasive, that means it affects several areas, several walks of a person's life, and any sadness that interferes with the quality of life on a day-to-day basis. If these four criteria are fulfilled, then that sadness is not normal sadness. Probably you're looking at depression. Now, for a fact, depression as a disorder is more common in women than in men. Today we are talking about men's health. So, are there any differences in, if you compare men versus women, do they differ as far as their presentations of depression are concerned? Yes, there are some peculiarities of depression in men. Men use more of alcohol and substance abuse. Men show more of angry outbursts and irritability. Men show more of risk taking behaviors. So, gambling, maybe playing video games, reckless driving. Some men who are depressed because they don't want to spend time at home and they don't want to admit that they're depressed. They work obsessively to spend long time at the office or maybe at the gym or outside home. This further reduces communication. There are clashes at home. Many depressed men actually attempt suicides, and suicidal attempts, so successful suicides are more common in men than in women. And overall, if you look at the depressive profile of men, you will find that many depressed men are misunderstood because they do not openly talk about their feelings. Men culturally are not supposed to cry. So when you feel sad, you need to talk to. Society teaches a boy to repress sadness or to deal with it. Be brave, be bold. That's the message given to boys, right? You can't cry. So peculiarly, you will find depressed men presenting with some of these issues. Now let's talk about lowered sexuality and depression. When they coexist, what happens? They form a vicious circle. So the person is depressed. There are biochemical changes. There are endocrine changes. As I said, the psychoneuroendocrine immune system, the functioning is altered. The serotonergic pathways, the hypothalamus, amygdala, hippocampus, the entire limbic system. There are neurocircuitry uh, problems which occur in the pathways, relative dysregulation of serotonin, and as a result, overall happiness is reduced. Because of this, there is anhedonia, which means there is inability to take interest in pleasurable activities, and therefore depression and lowered sexuality, they form a vicious circle. So there is lowered sexuality which worsens depression, and depression which worsens lowered sexuality. If you look at the statistics, about 29 to 33% of men who are depressed have erectile dysfunction. About 20% of them, especially those depressions which are particularly related to anxiety, they have premature ejaculation. And about 33 to 45% of men who are depressed have loss of libido, that is, loss of desire. What are the symptoms of depression? A typical case, if you ask me, say, let's consider a 55-year-old man who presents with loss of sleep. He wakes up very early, unusually early in the morning, say at 3 o'clock in the morning, and then is unable to fall asleep. There is loss of appetite, lack of interest in pleasurable activities. And as part of this, there is loss of libido. He cannot concentrate, is indecisive, is feeling hopeless, helpless, worthless, gets suicidal ideas, doesn't know why this is happening to him. Every day when he gets up from the bed, he thinks, oh my God, another day in my life. What do I do with this? I have to work the whole day. How will I have where will I have the energy? So there is fatigue. And then what happens is typically these people start withdrawing socially. People in the family, maybe they start giving him advice. Now you cheer up, come on, you have no problem, everything is fine. Why are you like this? Why are you so sad? Why are you so angry? Why are you so irritable? Cheer up, take interest, let's go out. But this person just does not enjoy life. This is because there is a dysregulation in his neurotransmitters in the brain which regulate your mental state, or your the so-called happy hormones, serotonin being the prominent one. Because there is a biochemical disturbance which he cannot correct himself, there is a lowering of functions. And what is important for us to understand here is, therefore, that this person is very often brought to treatment if the relatives are sensitive, or if the treating family physician or a physician who examines him refers to a psychiatrist. And typically all these things are discussed, and then the wife says, now you want to, whatever you want to say to the doctor, you please say, I will go out. And that's a sure sign that this man wants to talk about his sexual dysfunction. Then if the person is open enough, he talks about his sexual difficulties. And many depressed men, their self-esteem is really, really very low because of the sexual difficulties. How do we treat a case of depression? There are different modalities available. So there is drug treatment, about which I'll talk a little later. There is what is called cognitive behavior therapy. We have something called a cognitive behavioral triangle: your thinking, feeling, and behavior. Any of these things is affected, the rest too get affected. Here it's the mood, the emotions which are disturbed. So the person is depressed. As a result, the thoughts are negative, depressive cognitions, and the behavior is inactive life. So in cognitive behavior therapy, all the negative cognitions, they are recognized, and there is a reframing of these cognitions, as a result of which the behavior also gets changed, and subsequently the depressed mood improves. So cognitive behavior therapy is a very useful tool in psychotherapy. Then psychoeducation of the partner is very important. Why? Because the person who's living with this person, the caregiver, most often this person's wife or maybe his children, they need to understand that this person is not faking it, that this person really, really is depressed. And there is a biochemical reason for him to get depressed. Everything in the family is fine. Still, this person is depressed. He is not doing all this deliberately. So, making allowances for his inadequacies is what the caregivers need to understand. Marital counseling, if it is a problem. And what I'm trying to show here is there is light at the end of the tunnel. So depression is an entity, it's a disorder which is treatable, it is correctable. And when you treat depression, the entire quality of life improves and the sexual health also improves. Something in brief about antidepressant drugs. Antidepressant drugs improve depression, but they affect sexuality. And they affect sexuality adversely. It's paradoxical. Some drugs are an exception. I'm going to talk about them. So, the most popular among antidepressants nowadays that we use are SSRIs, selective serotonin reuptake inhibitors like fluoxetine, sertraline, escitalopram, paroxetine, etc. All of them, as a rule, improve depressed mood, but they cause a loss of erection. They might improve, especially drugs like paroxetine might improve premature ejaculation, but erectile difficulties are very, very common. So, on one hand, you're improving the person's mood, but on the other hand, you're depressing the erectile function. So, it can be a very dicey situation. There are some people who can manage with this. There are some people who are very sensitive to sexual dysfunction, erectile dysfunction, and they'll come and tell you, doctor, no, I cannot take this drug. Tricyclic antidepressants, which are still used sometimes, but they also do have sexual dysfunction. Amitriptyline, imipramine, dosulupin. Dosulupin relatively is a milder drug. It's a congener of amitriptyline only. So it can be used in people with who are elderly with comorbidities. Vilazodone is one drug which is a selective partial agonist and reuptake inhibitor. Serotonin partial agonist and reuptake inhibitor. It's called SPARI. Vilazodone is a very peculiar drug. It resembles SSRIs, but minus the sexual dysfunction. So, if a depressed, anxious person comes with sexual dysfunction associated with SSRIs, I would rather use Vilazodone. Bupropion is another drug which is norepinephrine dopamine reuptake inhibitor, which is again very commonly used to treat depression. Incidentally, you must be aware that it's also used to reduce craving of tobacco in nicotine craving in smokers. Trazodone is a multifunctional antidepressant. It's a very peculiar drug. The side effect of this drug is used as a therapeutic effect. So people with erectile dysfunction who are anxious, depressed, do better with trazodone. It's a very relaxing drug, causes a little bit of sedation too. But one of the side effects of this drug is priapism, persistent erection, right? So people with erectile dysfunction might actually benefit from this side effect. So trazodone is another drug which we commonly use. What are the tips for depressed men with lowered sexuality? How to maintain a sexual drive in spite of being depressed? Keep the flame burning. Don't give up, is what we tell them. Whatever worth it is, whatever you're able to do. In fact, this applies to all the functions in a depressed person. We tell them that, look, depression is like a fracture. I mean, if a bone is fractured, you don't expect to run, right? If your leg bone is fractured, you can't run. So allow the fracture to heal, and then you'll be able to walk, run, everything. Similarly, depression is a fracture of the mind. And because the mind is fractured, it cannot function to the same extent as a normal mind. However, some functions of the mind may be intact and you are able to function somewhat. In that case, so keep the flame burning, keep some sexual activity going on, whatever is possible. It could be hugging, kissing, just holding hands, whatever. So, in the end, I have written redefine intimacy. So, redefining intimacy during this phase is very important. Stop comparing yourself with others. Somebody else is so happy, somebody else is enjoying life, I am not able to enjoy life. No, you are not well right now, and you are not responsible for what is happening to you, but you can be responsible for the recovery. The message that we give to any patient with a mental disorder is that you are not responsible for the disorder, but you can be responsible for your own recovery. So, one thing, by seeking help and following the advice which is given by the mental health professional. Open communication with the partner is important about the mood, about load functions, about load sexuality. And if the partner, if the spouse is able to understand the difficulty that this man is going through, things are fine. Are there any tips for healthcare professionals with reference to sexual disturbances in men? One, sensitively inquire about sexual functioning. How to ask about sexual functioning? There are different ways that you can approach the topic. If you don't feel comfortable talking about it, maybe you refer. But if you feel comfortable talking about it, you can ask a general question about how's your sexual life been? How's your married life been? And then reduce it to sexuality, and then the current effect on the sexual life. If there are any misconceptions, psychoeducate them. The commonest misconceptions we find at all ages. All ages. Please do not think they're only prevalent among young people. I'll give you a few examples of different misconceptions which people have. Talking about young people. Nowadays, in our country, cannabis use has increased tremendously. And it's become so rampant thanks to legalization of cannabis use in some states in the USA. And our kids, they think that if USA legalizes cannabis, it is safe. It's really, really difficult for me at times to convince them, because they show you cuttings of newspapers on the internet showing that cannabis is safe, cannabis is good, it gives you a kick. But then they also realize that cannabis reduces the sexual performance. Even plain tobacco, smoking cigarettes also reduces sexual performance. When it comes to alcohol, Shakespeare has said that alcohol increases the desire but takes away performance, right? So it's a well known fact. So, misconceptions about substances, that they give you a kick. I mean, I have had a case where a boy and a girl, I'm telling you a true story, this is no exaggeration, please believe me. A boy and a girl married each other, and on the stage, while they garlanded each other, they were both under the influence of cocaine. And both of them obviously got divorced after 6 months. So there are myths, there are misconceptions about several things when it comes to sex. A little older age group, if you see young married people, they carry some impressions about sexuality based on what they have watched in the porn films. And then they forget that pornography is not what actually happens in real life. So, a lot of sexuality education is required. There are different dimensions of sexuality education. I gave you the example of a kid who asked me discuss the concept of beauty, and I told him, I told the entire group, I still remember, that wherever there is beauty in nature, it's associated with sex. Wherever a flower blooms for reproduction, that's sex. A cuckoo gives a call, it's a mating call. A peacock dances, that's a mating call. So wherever there is beauty, you will find sex. So the healthy place for sex has to be highlighted. Otherwise, our children, our adolescents are only going to get educated looking at porn. And before they even get exposed to normal sexual relationships, their imagery is polluted by pornography, which is a sad state of affairs. So, psychoeducation is very important, and I think it's a role of all of us, each of us as medical professionals, as mental health professionals, to educate people about sexuality. And sexuality education is not education about physical sex. Animals also have it. Nobody needs education about how to have sex. When I say sexuality education, I mean giving education about different dimensions of sexuality that I mentioned earlier: physical, psychological, social, cultural, religious, respect for a woman, several aspects to it. When it comes to depression, diagnose depression, refer to a psychiatrist if you're not capable of treating it, or learn to treat it and treat it adequately. Treat it adequately. Do not get scared of treating depression. Depression is a treatable disease. A depressed person seeks help and is usually cooperative. So learn how to treat depression and treat depression carefully. And as you prescribe antidepressants, be watchful for changes while prescribing medicines. There are several other disorders like anxiety, like schizophrenia, like OCD, like several disorders in psychiatry which present with sexual dysfunction, but I'm not going to talk about them. And as I said, I chose to spoke mainly about depression because it's common, and two, because it is treatable. Thank you very much.
Thank you very much, Dr. Manoj. For that, I have some talk on depression and sleep hygiene, which are so essential to have a good quality of sexual life. I now invite Dr. Narayan Reddy to give us an expert comment in the lieu of what has been told by our three eminent speakers.
Thank you, Dr. Samuel. Actually, I think expert comment is not warranted because the experts have already spoken about the issues. But anyway, since I've been asked to pass some comments, let me do my job. Now, I'm very happy that Dr. Sashank Joshi has touched upon a few things which most of us sexologists are not paying attention to. One, we always talk about testosterone, think about testosterone when you think about a low desire. Dr. Joshi very clearly said hypothyroid is also equally responsible. And my recommendation is that all of us should also estimate thyroid levels. One. Second thing, he has also touched upon a very pertinent issue with that of body image. With aggressive advertising and media focusing on six packs, men are falling prey to body image. For example, Raymond says the complete man. That means only when you wear Raymond suit to become complete man. So it becomes body image. And you become unisex salons now, men making up for them, and bald people are trying to have hair transplant, etc., etc. They are very relevant because that affect the self-esteem of the men, which adversely affects sexual relationship. Again, Dr. Joshi very clearly told that negativity should not be there. We should always look positive. And I was explaining about men from two different dimensions. I am really happy that he touched upon positivity. And finally, all of us know that India is the diabetic capital of world, and most of us know or heard about diabetes being one of the main causes for erectile dysfunction. But many of us are not aware that diabetes mellitus also can affect libido. So these are the take-home messages which I can pick up from Dr. Sashank Joshi's erudite lecture. Thank you, Dr. Sashank. And coming to my friend, Dr. Deepak Jumani, I don't have to tell you, he's a very colorful personality not only in his attire, but also in his slide presentation. I'm amazed by the way he presents his slides. Very, very important point which he writes is that Dr. Google misleads us, and how the advertisements on the net are being gobbled up by our patients, and we are being questioned by our clients, which we are not even aware that these drugs can help, these foods can help, miracle foods. And again, Dr. Jumani, I have heard him speaking in other webinars also, where he spoke about natural foods will enhance our sexuality. Now, he is also spoken about non-genital sexual activities. Very wonderfully, he showed us a mouse scrubbing the back of a person. I really like it. And another thing which he said is there should be no disagreement between husband and wife. The husband should agree what the wife says. And I very clearly understand there's a joke that men are agriculturists because they have agriculture. And not but most important, I am reminded of Reader Digest joke. Very clearly it says, the joke, I believe the joke goes, that God created men, an ass, and a monkey. And he said, 20 years of sex life for you. The lion said, God, 20 years is too much for me. 10 is sufficient. Then man said, God, please give me those 10 years. So God gave him 10 additional years. Then monkey told God, 20 years is too much for me. 10 years is sufficient. Man again said, God, give me those 10 years. So God gave him another 10 years. Finally, donkey also said, God, 20 is too much, give me 10. And man said that God, give me those 10 years. That is why at 20 to 30, man behaves like a lion. Between 30 and 40, he behaves like a monkey. And after 40, he makes an ass of himself. That very clearly he said that men become naughty after 40. But there is one wonderful take-home message which Jumani has given is about communication. I am recollecting a wonderful quotation. I don't remember today the author of this quotation. He or she said, define sex. Sex is the most intimate form of interpersonal nonverbal communication. So, communication plays a very great role in enhancing the relationship, especially sexual relationship. Thank you, Jumani. And coming to Dr. Manoj, that I was only worried that he will only talk about drugs. Thankfully, he didn't spend all his time only talking about drugs because we as doctors are trained to treat a person as a case entity rather than as a human being. And we are always happy. We think in terms of what drug to be given. That's how our medical curriculum trains us. But Dr. Manoj very clearly told that it's very important for us to understand that we should include talk therapy when you are managing mental health issues. And he also reassured us that most mental health problems are treatable. Like Jumani says, it's a correctile dysfunction. Mental health also is a treatable function. Again, he brought about the distinction between depression and sadness. It's very important for us to understand. We should not dub anybody who feels sad to be a depressed person. And very, very important, is the egg first or chick first? Is depression causing the sexual problem or the sexual problem causing a depression? Dr. Manoj very clearly told we should differentiate because then we know what to attack, either the depression first or the sexual problem first. I am very, very happy that Dr. Manoj has very clearly told that how to handle depression and not just with drugs, but with talk therapy. He also gave us 3 drugs which will have less side effects when you treat depression. One is vilazodone and bupropion and trazodone. Very important for him, for us is what he said is very clear. If you can manage something, you can manage. If you think you cannot manage, please learn to refer. That means we all must know our limitations and we should get into the habit of referring our clients to our colleagues without getting egoistic about that. And I thank Dr. Manoj for this wonderful take-home message. And all the 3 erudite speakers given wonderful take-home messages. I thank and applaud each and every one of them.
Thank you very much, sir, for your wonderful summing up and giving us the best abstract of men's lost narrative. Now, I invite Dr. Goda Venkataramana, a senior dermatologist and sexologist from Hyderabad, and are known for moderating panel discussion and debates to moderate this useful panel discussion on मर्द को भी दर्द होता है.
Today, the topic for debate or rather panel discussion is मर्द को दर्द होता है. My friends, today our Indian population is about 138 crores and odd. In this, total male population is about 70 crores and odd. Roughly around 22 crore people are suffering with sexual dysfunctions, maybe in the form of agony, physical problems, pain, discomfort, you name anything. In my 40 years of sexology practice, I have categorized all the males who suffered with dard, that pain, वो दिल का दर्द हो या बदन का दर्द हो, those people who are suffering with dard, I have categorized into 4 categories, namely unmarried males, males single or in relation, married heterosexual males, third, married in homosexual activity, MSM or bisexual males, fourth category is divorced, living separately or widowed population. All these 4 people are having dard. When I recollect what my patients complain to me, these are the people who are having dard. मर्द को भी दर्द होता है जब girlfriend says that yours is small. So that fellow will feel panicky and his self-esteem come down and he will be depressed and feel pain. Another area is मर्द को दर्द होता है जब सुहाग के रात बीबी says 10% वो मीठी दर्द, 90% वही पुराने यादें. So this fellow will feel cheated and he feels pain. दिल का दर्द होता है. मर्द को भी दर्द होता है जब बीवी हाथ उठाता है. A domestic violence. Now today, this is picking up. A lot of men are domestically harassed. This is another entity where the harassed don't want to be their husband. I want divorce. Wife says, you cannot take divorce. You will be my husband whether you like it or not, till I get other alternative. So till that time, this fellow has to undergo domestic violence, where he will be feeling the pain. मर्द को भी दर्द होता है जब बीवी से मिलने के बाद एसटीडी लग जाता है. So this fellow suffers physical pain and he thinks that wife is cheating me. मर्द को दर्द होता है जब बीवी says, "Shut up! I am earning more than you. Listen to me." See, another area where that fellow will get pain. मर्द को दर्द होता है जब 1 साल के बाद घर आया तो बीवी 6 months pregnant है दिखता है. So this fellow again will feel psychologically depressed, cheated again. मर्द को दर्द होता है जब बीवी says you are unfit. So it's again psychological turmoil to the husband. मर्द को दर्द होता है जब बीवी says, बीवी gets attracted to other woman. So he again feels pain and psychologically goes a lot of cyclic areas and pain, agony, depression, all पूरा दर्द का दिल का दर्द होता है. मर्द को दर्द होता है जब girlfriend jumps out with his money and belongings. So he again feels cheated here. मर्द को दर्द होता है जब his MSM sexual partner bites him on his genitalia. So that fellow feels physical pain here. When his beloved MSM sexual partner says goodbye, so this fellow will feel psychological pain here. So it's depressed. मर्द को दर्द होता है जब सेक्स में दर्द आने लगता है. Then this fellow feels physical pain in the sex when participating in the sex. So this is a badan ka dard, physical dard. So this pain in relationship and or during sexual intercourse is not a problem limited to women, as many men also feel this relationship pain as well as in sex also. Experiencing this problem may not only affect the sexual performance but also affect the sexual pleasure also. As a result, now the men race are catching up, raising their slogans, rising for their rights, and getting demonstrations and foundations for against pleading the government to give more this one Purush Ayog they want. So all these things because Marad now today is feeling pain, is feeling dard. So this previous speakers also told 60,000 married men committed suicide in 2004 across the globe. This is all because men under depression are successfully doing suicides. Their attempt is successful, whereas in women, it is only attention-seeking attempt. In men, they will complete the suicidal attack. As a result of this, every year for last few years, Men's Health Week is observed in the month of June, where there is no law now protecting men against domestic violence in India. And lot of issues are occurring in the men's health, and people are coming onto the roads and demonstrating and saying and praying for relief. And men's rights are human rights nowadays, they are crawling across the globe. As a result, as I told you, in the month of June, International Health Week is observed, whereas Men's Health Day is observed on November 19th. In order to discuss about what are all the reasons why the Marad ko bhi darad hota hai, now we have a panel discussion. I am inviting the panelists, Dr. Ritu Santwani, a well-known gynecologist, infertility specialist, and sexologist from Pune. She is the director of Shamwell Health Women Clinic and Test Tube Center. I welcome you, madam.
Thank you, sir.
The second panelist is Dr. Paras Shah, Director Sanidhya Hospitals, Ahmedabad, consultant sexologist as well as his executive CSCPI. I welcome you, Paras.
Thank you, boss.
I welcome Dr. Varsha Reddy, a geriatric physician and Vice President U3A at Navi Mumbai and Secretary IMA Whitefields, Bengaluru, Faculty Public Health Foundation of India, and Assistant Professor Devarajas University, Bengaluru. Thank you, Varsha Reddy. Thank you for coming. I invite you once again for this panel discussion. Now, I request Dr. Ritu Santwani to speak for 5 minutes about what are the reasons for the married men getting dard.
Yeah.
Over to Ritu Santwani,
Yeah,
please.
yeah. Thank you, sir. Before I start, I want to thank Dr. Jumani, sir, for inviting me here. So I want to start my the answer of this question with the lines of the Russian author, the Leo Tolstoy, who has quoted the biggest failure, the biggest defeat and pain for the male is the failure in the bed. And contrary to that, what's the famous Indian movie has come कि मर्द को दर्द नहीं होता. So when I come to in my practice, so this is totally contrary. So I wonder, there are so many male patients are coming to us with this, the मर्द को भी दर्द होता है. I think, the sir, you have enumerated so nicely in your slides all the situations and all the criterias. In this, only I argue in for one, that where you have shown the female is for the for the violence to the male. So rest. All I am agree with you. So as we all know, for this, in all the four phases, the desire, erection, ejaculation, and the pleasure. So any one of that can be affected, and the male can suffer from the dard. So I think, sir, you have enumerated each and everything. So I don't think I have to add anything. Sir, you have enumerated very beautifully in your slides.
Thank you, ma'am. So these are all the reasons why the men will get hurt in the relationship.
Mm.
They are nothing but denial, resentment, wounded, discouragement, anger, mistrust, defeated, rejected. So these are all the things. All these things may be because of unintentional or intentional. Most of the times the male gets dard because of the intentional hurts. If the spouse spending too much time on the computer, social media, voluntary tasks, this fellow will feel dejected. He thinks that she is not interested in me, she is not taking care of me. And another area is lying about your finances, having an affair outside, not being helpful with the course, avoid talking about sexual problems, in-laws matters, pension concern, showing lack of respect for husband, sabotaging the marriage, being irresponsible, not keeping up the promises. So these are all the areas in the married life the marad is getting dard. So one of the keys for successful marriage is to appreciate the strengths of the relationship. All the couples face difficulties, all the couples have differences. Yet it is the what you call communication, what our previous three speakers talk about it. So that makes the individual to have a smooth relationship. Otherwise, these are the intentional hurting is the problem that makes the male to feel dard. Now we'll go to Varsha Reddy. Please speak for 5 minutes on reasons for unmarried men getting dard. Over
Yes,
to
sir.
Varsha Reddy, please.
Men need sex to feel loved, sir, and women need to feel love to have sex. So this is a basic differences we see in men and women. Coming to the unmarried men, as already you mentioned, why married men are getting pain, all the causes are vice versa to get a pain for an unmarried person.
Amen.
He wants a house, he wants a beautiful car, he wants to have a nice, beautiful, educated wife. So there are certain areas where he emphasizes to get to that mark level.
Yes.
Apart from that, there are certain medical causes which already most of the eminent speakers have discussed, about lack of lubrication, prolonged vigorous sex, delayed ejaculation. There can be in unmarried man, there is a lot of use of condom or lubricants are there, like allergies can be there. Then STDs can be there, infections. So these are all the areas where medically they can get the pain. Apart from that, the more emphasis I usually prefer to give is psychologically. Psychologically, men are most neglected part of the society, I feel, especially in Indian scenario. Of course, being a woman, me speaking like this might be something different. Actually, men always enjoy a relationship where they can feel good about themselves. It has become common that men needs to be admired. The woman makes efforts to please herself. Usually men try to do that. but vice versa, it doesn't happen by the men, women to be done for the men. But this won't work with the woman. So there needs to be a midpoint of balance between both men and women. So this is what the unmarried man is trying to do it, I think, before getting married. And these things are affecting, and apart from that, as most of the speakers mentioned about the technological aspect and pornography, where before they are evaluating or evolving into the sexual life in a normal way, they are getting into all these things, and they are trying to become more experimental in that these all stuff, and trying to be more experimental, they might be going on a wrong path. So that might be one of the cause for getting pain, taking a lot of multivitamins, taking a lot of medications, or falling for the advertisements. And the imagination is endless looking at the internet. So that is where the problem happens. Second thing is education and awareness. Education and awareness is one of the very big thing lacking in Indian setup. Whereas if you see in European setup, it's very openly spoken since the kids they go to school. So simple examples like talking about a banana, it looks like your penis, and all those things are very elaboratively spoken to the kids as well. So which is not spoken here, and that is where the male person is not able to express, neither the female are able to express. But this is where the men specifically try to be more, I think, more innovative and trying to go a step ahead. And of course the body image and the way they look, or the way they want to perform, or the peer pressure, the way they talking into talking with each other, these all things are the reasons for getting the pain for an unmarried man, I believe. And the most important last factor, I feel, though I utilize the technology in and out, there is a fine line between anything going excess. So I think the technology the younger adult or younger generation are using is enormous, and because of that there is lack of sleep. Due to lack of sleep, there is lack of there is irritability, lack of nutrition, and this is going like a vicious circle, and they end up into depression. Of course, they end up into depression, they are going to go for the medications, and medications are going to go for the decreased libido, and rest of the story we all know about it. So these are the certain things we need to emphasize, and that's all I wanted to say about sir. Thank you very much.
Exactly. As rightly pointed out, the unmarried fellow gets hurt or gets darar, you go for the wrong partners. You only see what you want to see. You are not seeing as a holistic picture of the partner. You fall for people who are unavailable. Just watching in the porno, taking porno as a standard, and you are searching for people which is not a reality, not unavailable. You seek out the familiars. You think you are not worthy of love, a self-pity. You are afraid to be vulnerable, domestic violence. You don't know what you want, a confused state. So these are all the areas where the unmarried fellow gets dard. So this psychologists have put into two categories, where first situation is a person gets dard when the partner is physically present yet psychologically absent. Say, for example, his girlfriend is addicted, or girlfriend is having extra affairs, or girlfriend is overconsumed by work not giving enough time to this fellow, where the physically present, psychologically absent. The second situation, where the person is psychologically present but physically absent, so where wartime missing, natural disasters, breakups, serious injuries at the bed, on deathbed. So where psychologically it's their fresh memory is there with him, physically they are absent, they are on the deathbed. So these are the situations where the marad will get dard. Thank you, Varsha. Thank you for enumerating. Now we'll go to another speaker, Dr. Parasha. Why the men get dard when the partner or the wife is having vaginismus? Dr. Paras, please share your expertise.
Yes. Good evening, everyone. On onset, let me thank Dr. Samuels and Goa IMA for arranging this wonderful webinar. Deepak Bhai for inviting me, and Dr. Venkataraman for conducting absolutely giving insight of this मर्द को दर्द होता है. Why मर्द को दर्द होता है? मर्द को दर्द होता है because मर्द have to perform. आज का जमाना है कि जो परफॉर्म करता है उसी की कदर की जाती है, जो परफॉर्म नहीं किया जा करता है उसकी कदर नहीं होती है. सो मैन इज ऑलवेज अंडर प्रेशर, अंडर टेंशन कि ही हैज टू परफॉर्म, he has to satisfy his partner, he has to look after to produce the kids. But when the persons get married and they are not able to consummate their marriage because of the vaginismus, there are so many reasons for non-consummated marriage. Maybe the husband factor, maybe the wife factor, maybe both the husband and wife factor, but vaginismus is a very common factor for the female. What happened in vaginismus, when the person tried to penetrate, vaginal muscles goes in the spasm and is not able to penetrate. Wife will be getting severe pain. I remember one case, one couple was referred from the Baroda, this is near to Ahmedabad. They recently married and shifted from the Delhi to Baroda, and neighbor complained the police that husband every night beats his wife. Police came and they find out, they try to keep the relationship. Whenever husband try to penetrate, wife will having the enormous pain, and because of this pain she started shouting. So neighbors thought husband is beating every night to the wife, and because of that they call the police. When they told the stories and they referred to the local doctor, they're able to find out that is nothing, no violence, but this is because of this thing. So see, whenever anything happens, so everything comes on the husband. The husband is beating, husband is not performing, and so he has so many things. What happened vaginismus, when he's not able to penetrate, then they don't know what to do, because it's a simple thing everyone can do. So why he's not able to do? So over a period, he will have the lack of desire, because he thinks, and whenever he try to keep the relations, always he's having the back mind whether I'll able to penetrate or not, whether I'll able to penetrate or not. And because of this psychological fear, he's starting losing interest. Same time, he's starting losing the erections also. So a vicious cycle will develop. He's not getting erection. Wife is not able to penetrate, take his penis because of the pain. And after a few months or after a year, when the family intervened and blame game start, husband said, I am potent. Wife said, no, he's not potent. He's not getting proper erection. And wife and husband said, no, she's not cooperating. She's not allowing me to keep the relationship. And so many things are then happen. And finally, this case goes to the court and divorce happened. So what I mean to say, okay, it's always not like that कि only females are sufferer. Man, मर्द को भी दर्द होता है when he is not able to penetrate, whatever the cause, whether he is not getting erection, whether wife is having the vaginismus, or he's having the premature ejaculation where he ejaculate before the penetration. But he has to perform, and he is the answerable. When he is not able to do, मर्द को भी दर्द होता है.
Excellent, excellent. So these are all the reasons. When he feels dard, if he thinks, is she not liking me? Hence intentionally not allowing me to enter inside? Or am I not strong enough to enter? So this fellow puts all his energy and he ends up in the erectile dysfunction, as you rightly said. Some people will feel her facial expressions make me feel that she is having an affair. That's why she is not allowing me. I am cheated. So that's why I am very much hurt. Another area where they get dirt is she feels as if I am raping her. You rightly said, a neighbor giving police complaint, raping her. Why should I love? I am very much hurt. So this fellow starts feeling dirt. With a lot of expectations, I married her. She ditched me. I am deeply hurt. So these are all the various views these people who get dirt in the when the spouse is having vaginismus. Thank you, Paras.
Thank
So now
you.
all three speakers have given their views in different scenarios. One with a single person, one with a married couple relationship, one with having a spouse on the vaginismus. Now let us surf over the physical problems. Badan ka dard. Now we'll go to Paras again. What are likely physical reasons for pain in sex for men?
See, physical reasons are first and foremost is the phimosis. Whenever there is a phimosis is not able to retract, whenever the erection is not able to retract the skin and he try to penetrate, there will be a very painful penetrations. So and there is the paraphimosis also. When
Yes.
in paraphimosis also there will be a painful penetrations or painful erections. Because of that, he will having the dirt.
Yes.
Second thing, there is some injury or infections or ulceration on the tip of the penis, on the glans penis, he will be having the pain during these things. Peyronie's disease is one of the cause for the pain during the erections. And these are I think this is a physical. And whenever there's lack of foreplay, he try to penetrate, the wife will be not lubricated, so
Okay.
he'll get pain.
So as you rightly said, these are all the list of problems that will cause physical pain in sexual intercourse. Sexually transmitted diseases, foreskin problems, injuries, infections, deformities, skin disorders, particularly lichen sclerosis, lichen planus, Zuhn's balanitis, Paget's disease, allergy hypersensitivity to condoms, priapism, other drugs. All these things are responsible for physical problems. मर्द को दर्द होता है. Excellent. We'll go to Varsha now. What are likely reasons in relationship causing dil ka dard? So Paras has told about badan ka dard. Now we'll go to Varsha for dil ka dard. Dr. Varsha?
Yes, sir.
Yeah,
Dil ka
please.
dard mostly related to the expectations and appreciation by both the partners, sir, again. So here the appreciation is lacking where whenever there is any issues, they are not outspoken by the male partner or a female partner, especially in the Indian culture.
Yes, yes,
So
exactly.
that are the reasons for the relationship causing most of the partners nowadays. We see they have a quarrel or a conflict. They are texting each other from sitting in, one is sitting in the lounge, one is sitting in the bedroom and texting each other, which is a like a silent quarrel going on in the Third World War kind of a stuff happening inside the house itself. So these kind of stories are related to the especially for having a major issues and the lack of communication, which is a major thing we see in day-to-day life. The communication issues were before also, but then when I think when our parents were there, they used to be ought to sort out the problems within the bedroom. Which are not in this tech world, it is not like that. It has become like a tech savvy kind of a quarrels as well. So there is no communication verbal and there are more misunderstanding coming up, and these misunderstandings are leading for this dil ka dard. That's what my thinking about
yes, exactly. You projected. There are many more areas. So this fellow will feel dil ka dard when wife says not interested in sex. When wife talks ill about him before his or her relatives. More demanding and nagging spouse. Criticizing for everything he does. When she refuses to come with him for parties, marriages, and social functions. When she compares with other men. So these are other areas where the man will get dard. Now we'll go to our Santwani. How to evaluate this problem of pain?
Yeah.
Dr.
So,
Ritu Santwani.
yes, sir. Yes, sir. So once the patient is presented to us with this problem, I think we have to go in each and every aspect. First, अब जैसे कि टॉपिक है हमारा कि मर्द को भी दर्द होता है, तो first of all we start with this for this whether the patient is having either a hypoactive sexual disorder, hyperactive sexual desire disorder.
Mhm.
Then we can come for, in this only the hormone analysis, the thyroid prolactin, I think is very, very important.
Mhm.
Then coming to the local part examination, in
Mhm.
some patients may present with hypersensitive glands,
Yes, exactly.
some with that, yeah, some may present with testicular pain, some may
Good.
present, as you already have shown in your slide, the condom allergy, lichen planus. I have seen already a
Yes.
patient. Lichen sclerosis of the penis is also reported.
Yes.
Then coming, then some present with the prostatic infection, also
Yes.
having a like this present or the pain in the sex.
Mhm.
And then we have come to this for the ejaculation portion, whether
Mhm.
it is a premature ejaculation, delayed ejaculation, or painful ejaculation.
Exactly.
And some may present is that like a either a loss of erection or a priapism. I
Mhm.
think that is also very, very important in that case. And
Mhm.
some may find it's very, very difficult to indulge in the sex due to some psychological pressure also.
Exactly. The healthcare provider should be always at the back of our mind. We should keep today, thanks to Dr. Google, all people who are coming to us, they are visiting Google and then coming to us for second opinion. They are not straight away coming to first opinion. So when he says, Doctor, I have dysfunction, don't carry away by that word dysfunction or their diagnosis. You have to take detailed history by history taking, physical examination, for male particularly per rectal examination, throw some light, and relevant lab tests, which you already enumerated. So all these things, at the same time, history should be whether it is situational or global. The problem is situational or global. That's very important. If it is situational, again it becomes a only psychological problem, not a physical. When it is a global, yes, we have to think. Whether this is occurring, that dard is occurring in erection, then it becomes erectile dyspareunia. We have to search for the Peyronie's disease, or balanitis, or balanoposthitis, short frenum, cardi, paraphimosis, and neurological damages one has to search. If it is ejaculatory dyspareunia, one has to search for prostatitis, seminal vesiculitis, funiculitis, epididyma orchitis, urethritis, urethral calculi, neurological damage, and drugs like antidepressants. One has to take the history and do relevant investigations. That's how we can take this. Now we'll go again back to Paris. What are the consequences of these Dard syndromes on male and on relationship?
I
Dr.
already told about the vaginismus. Okay, when this blame game starts,
Yeah,
so it will be destroy the relationships,
exactly.
and when these relationships are destroyed, it can end in the divorce also.
Yes, yes.
Many times I always says my patients, do not involve your family. This is your problems, try to solve yourself with the help of doctor, but don't involve your relatives, because whenever the relatives are involved, both the families are involved, blame game start blaming, always the boy says ke आपकी लड़की में खराबी है, and लड़की वाले says के आपके लड़के में खराबी. No one want to say कि no, fault is at our side, or
Yes.
no one want to accept कि problem मेरे साथ है. People forget कि जिस तरह भगवान ने आंख नाक कान दिया, इसी तरह ये भी बॉडी का एक पार्ट है. What happened when we get the fever? We go to the doctors, he will diagnose whether it's a viral fever, it's a typhoid fever, it's a dengue fever, and according to that, he will give the medicines. Once the medicines are given, your problem will cure. Same thing happened whenever you have sexual problems. You need to go to doctor. You need to go to proper doctor, not the quacks who labels Khandani Hakims or something like that, doctors who are having the proper knowledge of this subject. He'll diagnose, he'll take first detailed history. Once history is taken, he'll might ask some investigations. Once investigations are there, there will be treatment. He will prescribe medicine. They will be all right. As Dr. Jumani said, sex has no expiry date. You can have sex up to your last breath. But the only thing, marriage is always, you should build your marriage on the faith, not on the blame game. So
Yes.
whenever these blame games are there, relationships are spoiled.
Well, exactly. So the consequences on the male is that fellow will become anger. Some people will become depressive. They'll become low self-esteem. As a result, their fear of relationships that ends up in the erectile dysfunction or diverse, as rightly said by Paras. Or some people will addict to alcohols and substance abuse. Some people will attempt suicides also. So these are all the various consequences of events that occur as a result of Mard getting dard. We'll go to Dr. Varsha. How his female partner perceives the problem of pain. Dr. Varsha Reddy,
Yes, sir.
please.
So
How is it?
mostly female partner. Yeah.
Go ahead.
Female partner perceives the problem of pain in sex as very personal, sir. They won't talk about it most openly. And it is again, as I told you, there is no awareness and there is no openness about this in the society as well as within the partners as well. So they take it in I think not in a very right context. They try to hide it from the society, or maybe they don't want to talk it to their own partner also. If they are not satisfied with the act, they are not going to even open about if they are not satisfied about, or they are not having orgasm, they might have a fake orgasm. So this is how the female partners in India take it about most of the time. And if we see or talk, most of the patients or most of the females around us, we talk about sex. It is not openly spoken between two females as well. So it is like they are just a kind of a person who is sleeping on the bed, and the act is done, and they are having two faces on two sides of the bed. So like a sleeping pill, already Dr. Jumani has mentioned that it is like a sleeping pill. The sex act has been taken by the male and female partner most of the context. And this pain is taken even if she has a desire. She doesn't have a courage to express it. Maybe a cultural barrier, maybe the awareness barrier, or maybe a kind of thing she wanted. Maybe she doesn't want her partner to feel low about it. So these are the certain aspects where this is the way females take about pain in the sex.
Yes. So how the female perceives is depends upon the education, depends upon the strata of the society, depends upon the family values through which she was brought up. That decides what type of how she perceives of the problem. Some will perceive that at any cost they want to be in relationship to support him and to save the relationship. Some wants to be in the relationship, but wants to get pleasure outside. Some people want to take revenge for his behavior towards her. Some people wants to come out from this relationship, want to lead their own life. Some people wants to be in relationship, but they want to divert the attention on children or on social activity or on religious activities. That's how they perceive the problem. These are all appears. All will not follow the step. Some will go take the fourth step. Some will go to first step. These are all depends upon their education level, their social value system level, from their background will decide these things. Now we'll go to again Ritu Santwani. How his female partner can help to get out of this problem.
Yeah. I think, sir, physical and emotional support is very, very important in this problem. And
Excellent.
other very important thing, the patients which we are getting in these days due to of this severe vaginismus, also in that patient, some patients I'm seeing the lack of lubrication is also very very important.
Okay.
So in that patients, the use of the proper vaginal lubricants is also suggested. But I think the root cause is is the psychological and emotional support is very very important.
Important.
And
Excellent.
in some cases where is the premature ejaculation in the males, in that the squeeze out technique is also helpful.
Yes. So as you rightly said, support is very, very essential. Support the partner.
Yeah.
Take him to the doctor. Follow the doctor's instructions and love him unconditionally. I am recommending here passionate love, not passive love.
Yes.
Unconditional love that makes the relationship to save. उसका दर्द कम होता है. So love, commitment, sexual faithfulness, humility, forgiveness, time, honesty, communication, selflessness. So these are all the ways in which the spouse can contribute for the betterment of the male. Thank you for Ritu for giving the opportunity.
Thank you, sir.
My friend, to conclude, because already time is over, we are exceeding half an hour. To conclude this, it is uncommon to find one factor for cause and to cure 100% of the problem. It is uncommon to find one solution to fix the 100% of the problem also. Often physical, relational, psychological factors are all involved in causing and being impacted by मर्द को भी दर्द होता है. Always remember, जिसको दर्द होता है वो ये मर्द होता है. My friends, I thank one and all the panelists for their excellent contributions and all the viewers for their patient listening. Thank you one and all.
Thank you, Dr. Goda Venkataramana, sir. I for the wonderful panel discussion on Mard ko bhi dard hota hai. And I thank all our panelists, Dr. Ritu, Dr. Varsha, and Dr. Paras. Once again, I request Dr. Narayan Reddy for his expert comments and summing up the whole webinar.
In lighter vein, I do not know why we always relegate sex to the last thing in the day. And today our talk is also going till 11:30 at night. We should change our habits and time. Anyway, now I'm not going to comment on the panel discussion as far as the physical components are concerned. That is very clear, and Dr. Venkataramana and other speakers have clearly told. To summarize the emotional portion, man is under tremendous pressure. Why? Because he is expected to be a performer. And he has to rise to the occasion in order to perform, unlike a woman. That is why he has got more darad emotionally. And number two, looking at the emotional side of the relationship, I go back to Dr. Manoj. He used the word psychoeducation. I would like to slightly modify it because we're talking about sex. I would say sexuality education. Because man has got a fragile ego and he can be hurt quite easily. That's one problem. And a good sexual health education program will train all of us, especially the next generation, to give respect to each other, both the genders, to understand the feelings and needs of each other, ability to negotiate, compromise, and find a mutually acceptable solution. So the moral of the story is what all of us need is a good sexual health education. And Dr. Venkatamana has very clearly took it through his moderation as far as the panelists are concerned. In fact, I would like to offer the title of universal moderator to Dr. Venkatamana because all the webinars he has been the moderator. Thank you very much.
Thank you, sir.
Thank you, sir. I request Dr. Sudhir Sheth, our Secretary of IMA State Goa, to propose a vote of thanks.
Well, first of all, thank you one and all for joining in today. I like Ajit Ankeshwar, Dean of Sir JJ Group of Hospitals and Grant Medical College, for honoring our branch and sparing his valuable time by being our chief guest today. I'd also like to thank our esteemed faculty, Dr. Narayan Reddy, Dr. Shashank Joshi, Dr. Manoj Batavdekar, Dr. Deepak Jumani, Dr. Goda, Dr. Rajasri Brahmabhat, Dr. Paras Shah, Dr. Ritu Santwani, and Dr. Varsha Reddy for sparing their valuable time and giving us their useful and valuable inputs and encouraging us to understand a lot of men's sexual needs and its narratives. I'll also like to thank Harish Mehta and Dr. Dipen and Mr. Dipen from InvoCare for hosting this webinar. And finally, thank you one and all for joining in. Have a very, very happy new year and good night to all. Thank you. Bye.
Thank you all.
Thank you, sir.